I love scanning the ScanPost and the ScanBody in the mouth. It's very accurate. I get great tissue definition, and it's also timed very well, meaning that the ScanBody within the software has to be timed in the way that we fit the ScanPost and ScanBody into the mouth. If that's not timed right, if it's just several degrees off, your final restoration is not going to fit. So that's really, really important. But it is a longer appointment to mill these restorations, make sure the emergence is on, finish the restoration, cement it on the TiBase, and screw it in, particularly in a solid abutment crown. That's more realistic in one appointment. But anteriorly, if I'm doing a two-piece restoration, I'm going to usually not place that in one appointment. So the process for scanning a ScanBody on a ScanPost is really easy. You go ahead and take the healing cap off, you screw in the ScanPost, you make sure that you align the outside indicator in both the ScanPost and the ScanBody, so when you fit those together, the timing is right on. And I'll tell you, this is very, very accurate. I've compared it to both traditional type of impressions, pouring it up in stone, making it on that situation, using the ScanBody on a stone versus a ScanBody in the mouth. And I'll tell you, the mouth always wins. It's very, very accurate if we do it right. So it's real important to get that timing on. To take the optical impression with either the blue cam or the OmniCam is really easy. It's just normal. You just go ahead and scan the arch. Now, one thing I'm looking for is to make sure I have a gingival mask impression. In my clinical theater, in order not to lose that soft tissue emergence, once I take that healing cap off, I put in my ScanPost, put my ScanBody on that, and then I'm scanning. I want to capture that soft tissue emergence. Now, to get my gingival mask, I'm going to copy that over to my gingival mask catalog in the imaging acquisition screen, and I'll just cut out the implant, still maintaining that soft tissue emergence. It's really easy to get your gingival mask that way. Then we scan in the posing arch and also the bite registration with the ScanBody off. If the ScanPost and ScanBody are in place, the patient can't bite down. If you look at the literature for implants, our final restorations have a biological width. They have a horizontal biological width and they have a vertical biological width. The vertical biological width is somewhere between 3 and 4 millimeters. The horizontal biological width is dependent upon whether it's a switched platform or a traditional type of emergence. A switched platform is when the abutment emergence out of that implant platform, it's smaller in diameter than the implant. The current literature is showing that the switched platform has some advantages. But in addition to that, this is critical of this conversation. We'll get more into the switch platform and some of the emergence issues in another video. The real important portion of this conversation is we don't want to continually remove the healing cap and fit an abutment and go back and forth. If we can place the abutment with no more than removing the healing cap more than 3 times, the connective tissue attachment has a tendency to stay on the abutment and not drift down onto the implant platform, which means you're going to potentially get more vertical bone loss. There's more to come on that, so keep this concept in mind. To choose a solid abutment crown in administration screen, you'll choose biogeneric, or you could use biocopy, and abutment. This is the indication for a solid piece abutment crown, and then click on the tooth that you want to design that on. That action will change the step menu on the lower. There's a sequence that we go through. We're going to select the ScanBody type. We'll select our milling unit and then the material. So let's talk about the ScanBody type. There's 2. There's the ScanPost and the TiBase. The ScanPost is best for the mouth. It's kind of like a traditional impression post for traditional impression. Think of the TiBase as a stock abutment, even though it